everyone. This is Stephen Ferrara, Executive Director of the Nurse Practitioner Association, New York State. Thank you for joining me with this new interview series, the NPA Q A. Today I have Dr. Denis Tarrant, and he is the owner of Manhattan Housecalls in New York City. And we're going to get to know him a little bit today. So Dr. Tarrant, welcome.
Thanks so much, Stephen. Good to be here.
Great, great. So first question, can you tell us a little bit about your pathway to becoming a nurse practitioner?
Yeah, sure. I guess mine started much the way a lot of people do. I'm going to go back about 1,000 years ago when I was in high school. I think that was like 1910, 1911. But the idea in high school was doing community service, wound up working at a hospital, really appreciated what the nurses were doing there, and decided, quite frankly, as an 18-year-old to go into nursing school, and didn't quite know what I was doing for the first 2 or 3 years. Graduated with my BSN. And once I started getting out of the scholastic environment into the real world of working in a hospital, I really fell in love with the profession. I really fell in love with the mission. And then as I started progressing on a cardiac care unit, which I worked for at Lenox Hill for about 5 years, really found my independence there, where we started to do a lot of work with ventilator patients, that kind of thing. And I found that a lot of what we were doing was independent, but I wanted a little more. And I really got into that path of, do you go the PA route or the nurse practitioner route? And I said, I'm a nurse and I want to become a nurse practitioner, which back in 1995 wasn't a new concept. I mean, it's been around for 30 plus years at that time.
Right.
But it had still been a new concept in New York that there weren't a lot of them. It was a very PA-driven medical system at that time. Right. But I knew a few colleagues that went in to become a nurse practitioner. And thankfully, the hospital that I was at the time covered full tuition reimbursement. And I was all of 26, 27, and said, this is a golden opportunity for me to get a master's degree, earn more independence, learn a lot more, but yet be able to work at the same time and have it covered. So anyhow, 4 years later, graduated with my nurse practitioner degree. I haven't looked back since, but it really has sort of given me that sense of independence I had been looking for when I was a nurse, but legally didn't have, but had the drive to do it.
Right.
And then, which kind of, once I had become the nurse practitioner, there wasn't a lot of work at Lenox Hill for nurse practitioners, and there was essentially no time owed once I graduated. And then that kind of brings me, I guess, to where we are today, which I guess we'll go into it a little bit about what I'm doing now and so forth. But that was sort of my path into the nurse practitioner profession.
Great, great. And so you are a practice owner of Manhattan Housecalls, and certainly innovative, and you've been in operation for quite some time. So can you tell us, why did you start your practice, and when did you start your practice?
Yeah, sure. I'd love to say it's a storybook story to how we started, but it really isn't. When I graduated as a nurse practitioner, a few months later, a colleague of mine, a physician colleague of mine, had a nurse practice, a house call practice, and he was going away on his honeymoon and wanted somebody to cover his practice for about a month while he was away. Mm-hmm. But for a physician to get another physician to cover a house call practice at that time was just not going to happen. And I had known him personally. I had graduated 8 minutes ago. And he said, would you want to cover my practice while I'm gone? This is 3 or 4 months prior to him leaving. And he said, in the meantime, get your Medicare ID number, become a provider. I said, sure, I would. And that's kind of how I got introduced into the house call. Right. And I was with him for a little while. This is going back almost 20 years ago, and back in 2002. And wow. So I did that for a little while. He was gone for a month. He came back and pretty much said, listen, at this stage of the game, we can work out an employer-employee relationship, but we're not going to be friends much longer, because that's not what friends do, employee friend. Or you can try your own practice. And I knew nothing about it, but I did know that I loved the house call. I loved the independence that I had. And I really enjoyed the environment, and that we are making a real difference to very high need sick patients. So fell in love with it. decided to start doing it on my own, started on the side, seeing a few patients here and there, and worked as a nurse at Mount Sinai for about a year to sort of, pay the rent and that kind of thing. And then, I find once you deliver a good product, you show up on time, you do good work, the word started getting out that I was, quote unquote, doing house calls. And so then we incorporated in 2008 and I really started sort of promoting myself, if you will, by speaking to home health agencies and nurses and care managers and anyone who would listen to what I was doing. And at the time, there weren't a lot of people doing house calls. And so I thought by now the place would be overrun with people doing house calls. But at the time I had started the practice back in 2002, I realized we're in a niche profession where primary care was being driven out, private practice was being driven out. The cost basis of owning a private practice was very difficult to maintain your doors to keep open. And we had a product here that required very little startup, very little overhead, mostly knowledge and time as the main element of what I was doing. And so over the last 18 years, I've hired nurse practitioners to work with me. We've had office staff, like I said, incorporated, and we've done about 50,000 house calls since 2002 as a practice. So I believe we're probably the largest nurse practitioner-based home care house call practice in New York, unless there's another one that I know of. But it's really morphed. It started by accident, like most businesses do. And as Medicare rules and nurse practitioner regulations have progressed or regressed in some instances, we've had to pivot as a practice. But at the moment, it's a full nurse practitioner practice, social worker, a care manager, 2 office staff that run the practice, and everything is done from home. There's no brick and mortar because we do want to maintain that low overhead status as a practice. So that's kind of how we progressed as a house call business.
That's great. And I think you're somewhat unique because a lot of nurse practitioner owned practices that I see are very small and limited to a solo nurse practitioner. You actually have a staff of other nurse practitioners as well as other ancillary help. So it's quite unique.
I mean, I always felt that if I just stayed to myself and saw more patients, what I really do is I own my job. I don't have a business.
Right.
And I don't want to do that, and at some point, it's hard enough to get the maturity to be able to farm it out and to find quality staff that can do the type of work that's required to maintain these patients. Sure. So, I knew the path to success and the path to growth and the path to longevity and sustainability was not me hitting the ground every day. Yet it had to be required for delegation. And that took a few years to learn and to realize, but it's a must.
Absolutely. So we're talking about your practice and your business. Can you tell us what have been some of your top 1 or 2 challenges? What keeps you up at night?
More than 1 or 2 things, Steve. Listen, when I started this business, I was 28. I had graduated nurse practitioner school. And so somebody said, if someone asked me about workers' comp, what? Disability, IRS, W-2, 1099, LLC, it was way above my pay grade. And I really learned a lot of this as I went on, And so I think a lot of the challenges were 2. One was the business side of this, understanding taxation, understanding how a business is run, what you're responsible for, fiduciary, legally, what your requirements are as a business. And then the knowledge to understand it's actually not that big a deal. It's not that hard. You just got to know, So I think the first hardest thing, or I should say the biggest challenge was just the business, owning a business, running a business, understanding what your requirements are as a business and what your responsibilities are, whether you want them or not. Right. They're out there. But I would say, the other challenge has been being a nurse practitioner in the early 2000s. Who are you? What do you do? What's a nurse practitioner? And so when I started, nobody really knew what I was, what my job was,
Right.
or how I was going to do it. That's changed. Today people know who we are, what we do. But the collaborative arrangement that we had for 15 years, 14 years was a real problem.
Right.
Having sort of that physician stranglehold on the practice at all times was a real challenge as well. So now that has been lifted, thankfully, that's gone away. But, those were some challenges, just running the business, because as nurse practitioners and physicians, quite frankly, we're not trained in business. We're not trained in what a P&L is, or what what our ROI is, and MOUSC, all kinds of stuff, it was a real challenge, and it was intimidating. Sure. Because, as a nurse, you're taught, person first, do no harm. And then all of a sudden you own a business, and the bank says to you, well, who's your workers' comp coverage? Did I need workers' comp coverage?
Right.
Who taught you that? Nobody. And so I think that there's a paucity in that in the education level of the nurse practitioner of running a business. But that being said, that was probably the biggest challenge, was just trying to overcome the intimidation from what, of owning a business, which I think makes a lot of nurse practitioners not want to go into it. Right. Because it almost seems too overwhelming, and it really isn't. You just need to know what to do.
Right. So you mentioned 50,000 visits. I think was that right? 50,000?
50.
Yeah, 50. So that has to be part of a success, to have 50,000 of anything. I think. But what would you say are your, what would you say are you most proud of?
I'll tell you that competing on a primary care level and a high volume city with as much competition as we have in New York, and competing successfully as a nurse practitioner based primary care practice is something to be proud of, because it's not easy, and I think that when we open up our doors for primary care and become independent providers, there is a stigma that does sort of follow when you're not a physician. Should you be doing this? And I think the success in what we've done and the volume with which we've done is a testament to who we are as providers and practitioners. And so being able to provide jobs, provide positions for nurses, nurse practitioners, for social workers. I think being a part of the economy and not just paying my taxes, but producing taxpayers, and making and producing livelihoods is something to be proud of. And doing it all in the name of our profession. And what I would like to think, hopefully furthering the profession, that I believe one of the best things you can do for the nurse practitioner profession is to compete successfully in healthcare and provide a good product and a good name for the practice. So very, very proud of what we've done, the patients that we've seen, a lot of the nurse practitioners that have come through our doors, and just being able to provide a great working environment that is free of stigma, and really being able to grasp the independence of all of our providers and let them know that they are in fact primary care providers.
Absolutely. And I know you're providing much needed access to a population that doesn't have much healthcare access. So that
more now than ever. Yeah, more now than ever. When COVID really hit the city in March and April, it was an absolute brush fire. Right. It was a disaster, but we never stopped. We kept seeing them. We had a lot of patients that their doctors closed their doors. Their physicians were elderly. They didn't want to see the patients. Right. And we really wound up, I think, taking the reins and becoming a lot of the primary care providers for a lot of these patients who, quite frankly, had nowhere to go. So it worked out very well.
That's great. So last question for you is, so what advice would you give to someone, a nurse practitioner, an NPA member who is thinking about starting their own practice, that has thought about it for a while? What advice would you give to them?
Sure. And I know this is going to sound self-serving. Number one, become a Nurse Practitioner Association member. And the reason I say that, and it's not a plug for you guys, although it is, but the reason I say that is because I would not be as aware of legislation that affects my practice directly if I was not a member. If I wasn't involved, if I wasn't actively involved, I was with you and a lot of the other board members, I don't believe that the legislative push or the legislative changes would have occurred, which directly impacted my practice. Collaborative agreement, DNR, the list goes on. So you have to be a part of a professional relationship, or you're really just not in the know, and you got to be. You have to be. What else would I recommend? Really understand that you can do it. You can own a business. You can be successful. You can make a good salary by doing this, and you're not beholden to a hospital system. That you can create an independent primary care practice as a nurse practitioner. Whenever I have students with me, one thing I always tell them is that you belong here in this arena in primary care, and you're going to lead the way. Right. And so I think there's the belief that it can be done. If I can do it, anybody can do it. And that it should be an option, not a dream, not a thought, not a wish, but you got to start somewhere, and don't be intimidated by all the paperwork, which oftentimes when you talk to nurse practitioners, that's really the big wall or block into independent practice, So I really think belonging to a professional organization, AANP, NPA, federal and state, is massive, huge, and it really keeps you in the know. Have the confidence to understand that you can run a business, that you can be a primary care provider, that you can be a nurse practitioner that independently provides care on your own, and that you have every part to belong here as much as anyone else does.
Absolutely. And I want to mention that Dr. Denis Tarrant is a former past president of the Nurse Practitioner Association. And
oh yeah, I should have been full disclosure, I guess, right?
Yeah, full disclosure. Yeah, we got it out there. We got it out there ultimately.
Right.
So I lied. I said that was my last question. But my last real question is, what would you like to say? Do you have, how can people learn more about your practice? Do you have a website?
Yeah, sure. We just celebrated our 18th year on May 1st. So it's funny, I started this when I was 28 and all this had hair in it. And there was no gray, but it's www.medhousecalls.com, or primary care practice, primary care providers. Questions, concerns, issues, Dennis@medhousecalls.com. We've been around for a long time, and hopefully we're around for an even longer amount of time. Stephen, thanks so much, for having me here. It's always a great time, sharing time with you.
Absolutely, Dennis. Thank you for taking some time and telling us about your pathway. It's an inspiring story. And I think a lot of our members and a lot of those who are out there in the nurse practitioner world will certainly hear this and be motivated to do something on their own. So,
I hope so.
Absolutely. So with that, thank you for viewing this interview series, the NPA Q A with Stephen Ferrara of the Nurse Practitioner Association, Dr. Denis Tarrant, and we'll hope to see you soon. And the last thing I'll say today is if you have any suggestions for us, anybody you'd like us to interview, or if you yourself are a Nurse Practitioner Association New York State member and want to be interviewed, reach out to us, info@thenpa.org. Okay, well, have a great rest of the week and take care. Thanks again.
All right, Steve, take it easy.
All right.